Hey guys, welcome back to the podcast. I'm Amanda,
I'm Laura.
And I'm Kendra.
and today we have a special topic by Laura. Take it away.
So, a few years ago, I became aware of the concept of nonviolent communication. And I will tell you, there was a time in my life, if I had heard somebody, probably during my medical training, if I heard somebody say nonviolent communication, I would have thought they were an oversensitive hippie or something. Like, I would not have given credence to this concept. However, I really have come to, I don't know if testimony is the word, but I have come to really understand the importance of our words, and that sometimes when we're mystified by people taking things we say in a way that we didn't mean, it's because we're using language in a way that, well, basically, we're just not realizing how we come across. And what nonviolent communication does is it teaches us a framework to communicate with other people where that is less likely to happen. Now, ultimately, the way people receive things is also going to be on them. However, this is a great framework so that we can communicate with our spouses, our patients, our children, our friends, colleagues in a way that is going to be the most beneficial. And we know that old saying, sticks and stones may break my bones, but words will never hurt me, is like, there's nothing like seeing what happens on social media and what happens to people who are victims of cyberbullying to show us that that is absolutely not the case. Our words are possibly one of the most harmful things that we can use to hurt people. So I believe it's super important to learn how to use them well and do as Hippocrates said, first, do no harm. So that's what we're going to talk about today, nonviolent communication.
This is a great topic, I think, because so many of the people that we talk to are like, I don't know, everyone in my office is just really sensitive. And that may be. I do find when I'm talking to different groups of people, if you're talking to a bunch of ER docs, like a lot of it's going to bounce off of us. If you're talking to certain other populations, it's not. It's not the same humor. I was teaching a ACLS class and like joking around that the patient didn't make it. And like some people were horrified. And I was like, are you serious? It's a fake patient. You know what I mean?
It's like your
But
handshake meme.
yeah, but anyway, it was like, okay, so we do need to like take into account who we're talking to. And then this, I love this, Laura, that you're giving us the skills for what to do when you read the room and maybe your usual way of communication isn't appropriate.
So we'll start by defining what is nonviolent communication. It was developed by psychologist Marshall Rosenberg. Nonviolent communication is a framework for communication that centers empathy, clarity, and connection instead of blame, criticism, or control. Why does it matter in healthcare? Well, we've talked about this before. Medicine is hierarchical, emotionally charged, and communication intensive. We all, whether you're in the ER or not, work on a team. This is not a standalone profession. We rely on teams no matter where you are. And so that relies on effective communication. And sometimes we're in super stressful environments. No matter where you are, things get out of hand or completely go awry. Unexpected things happen all the time. And so that can really charge emotions. And people, when they get supercharged, it's very difficult to pause and introspect for a moment. Doctors are trained to diagnose and fix, but often not taught how to listen with empathy or connect authentically, which we are big fans of, authentic people showing up every day. Harmful communication erodes team culture, increases burnout, and impacts patient care. So some common pain points in medical settings: miscommunication during handoffs, which there have been several articles written that state this is a high liability area, is handoffs. We hand off at the end of our shift. We hand off, when we're going from ED to inpatient, when we're whatever. This is a delicate situation and miscommunication can happen. Chronic tension between departments or staff. Sometimes in the ED, we think it's us versus the world. It's always us versus them in the ED. It's like everybody else in the hospital and then the ED. And we kind of band together, but we tend to have a groupie mentality. It's like everybody else is haterade for the ED, but that's not always the case. Physician burnout from unspoken or unacknowledged emotional burdens. So this can be stuff that you're dealing with at home that you don't realize that you're bringing to work with you every day. The cost of poor communication. 70% of sentinel events in hospitals are linked to communication breakdowns. This is from
That's
the Joint
big.
Commission in 2015, and that's what I was talking about. It's a very delicate situation when you're handing off the patient in any going from OR PACU to the floor or OR to home or ED to inpatient. Like that is a very delicate situation, and I think sometimes we don't respect it as much as we should because of the amount of effective communication that goes into it. Miscommunication increases emotional exhaustion and compassion fatigue. That kind of goes without saying. I love this quote from Brené Brown in Dare to Lead. She actually taught this to her kids. I love it. Clear is kind, unclear is unkind. And she says it to her team all the time, too. Being clear or having a moment to clear the room before they leave a meeting. If she even notices that someone in one of her leader meetings and department meetings, whatever she calls them, is starting to, like, she can feel tension entering or anything, she just pauses the agenda and is like, okay, are we all on the same page? Is everybody with us? And then they've developed the culture where whoever is feeling uncomfortable or maybe has a little bit of emotional reactance at the time clarifies. Okay, so what I'm hearing is, and they just take a minute. And if it derails the meeting, she's okay with that because it is very clear in the culture of her business that she has created that clear is kind and unclear is unkind. She doesn't want anyone leaving the meeting without clarifying either what's going on in them personally or maybe in a certain part of the team that's involved in the project, maybe misconstrued something. So she harps on that a lot. And I think that could very well impact that statistic I just talked about, where 70% of sentinel events in hospitals are linked to communication. Imagine if we all had that mantra, clear is kind, unclear is unkind. It would probably go a long way.
Well, and
Yeah.
with the lack of vulnerability that a lot of us carry in there, not just physicians, I feel like also nurses, I feel like are scared to ask us clarification questions
Oh
sometimes,
gosh, and that's
especially
so
if we have
dangerous.
nonviolent. Right. Like, so I think that this is a great topic to help us.
I want to add that, we're talking about authenticity, we're talking about clarity. This is not the same as unbridled expression. So remember that losing strategy from a few podcasts ago that we talked about of unbridled expression? That's where we just dump everything we think on people. That's not what we're talking about. We do want to say what's important, what's true, kind, and necessary to be said. And this framework helps. But this is not carte blanche to go tell your partner that you think they're completely incompetent, or to go tell, your nurse manager that you think she's doing a horrible job. And in those terms, this is a way of being able to communicate non-judgmentally to help improve outcomes. So here we go. Here's the nonviolent communication framework. Okay. Firstly, there's 4 components of it: observation, feeling, need, and request. Okay. And it's interesting, we talk a lot about facts and story. That this nonviolent communication framework correlates with a book by the same name. Marshall Rosenberg wrote a book, Nonviolent Communication. So check that out. Also, Crucial Conversations. If you are not familiar with that book / training system, that's a great resource for learning nonviolent communication as well. And it's a similar framework that they use. So that first component, observation, is stating facts or things that you observe without any judgment. So an example I use sometimes is the socks on the floor. I have this one child who is the kindest, most, he's just a brilliant, wonderful child, and he takes his socks off and leaves them everywhere. And so what I might, if I were communicating violently, I might say, what the heck is wrong with you that you leave your socks everywhere? Which I would never do. It hurts my heart even to say something like that about this kid. But I could say it about other people. Certainly have said things like that about other people. But I could say instead, when I see your socks on the floor, So that's the observation. And then we go on to the feeling. When I see this, I feel. So we're pulling the responsibility for our feelings back onto ourselves, which is where the responsibility lies. We are not accusing the other person of being something. And that's where the verbal violence comes in, is when we name call, basically. And we don't always see it as name calling, but when we're saying, you're thoughtless, you're lazy, you're whatever it is, you're incompetent, things that, hopefully we haven't heard in our lives, but coming through medical training, we probably heard something like that. If we're saying you statements, we need to reflect and say, is this how I want to frame it? Is this a nonviolent way of communicating? So when we say, when I see the socks on the floor, I feel frustrated and a little bit sad, because number 3 is the need, because I know we've talked about this, and it's my hope that I can feel like you hear me. And my request is that when you take your socks off, within 15 minutes, you get them to a hamper or you put them inside your shoes. What do you think about that? Would you be willing to do that? So you're going through your observation, you're feeling the need that you have that you feel like is not being met, a value or universal human need underneath, and then making a request. So here are a couple examples to, that may apply more to work. So a nurse questions your discharge plan. Okay. Instead of getting defensive, you say something in that nonviolent communication framework. So she says, I really think that this patient needs to leave now. There's really nothing wrong with them. And then your plan is to admit them. You say, when I hear you say that you disagree with my plan, I feel concerned and I want to understand where you're coming from. I also want to make sure that I'm not undermined in front of the patient and in front of the other staff. Would you be willing to keep these concerns between you and me, and let's talk it out? And because I know we both have the patient's best interest at heart. We both do. Again, it's forming things in terms of what the facts actually are, what you're seeing, what you're hearing, not like you're talking to me so mean. No, it's like, when I hear you say you're an idiot, I feel angry. Can you see the difference? And so maybe they are talking mean. However, they're not going to receive it well when we're accusing. If we keep things coming from our perspective, the conversation's going to go better. So, like, say you get home from work and you flop down on the couch because you're exhausted, and your partner says, well, it must be nice to just be able to come home and lie on the couch while I've got all this other work to do. It's sarcastic. It would be very easy to be reactive and defensive in that moment. And that's going to cause more unpleasantness. So a different way to approach that would be, when I hear you say, it must be nice, I feel sad. I feel unsupported, and I feel like you don't understand how I feel. And what I need is to feel supported, and I need to feel like I have a partner who cares about my well-being. I'm open if there's something that I'm doing that's affecting you negatively. I'm open to hearing that. I'm just curious if you'd be willing to pay attention to what you say to me after work, because I am really tired. And your words, they affect me. And I want us to have a good, strong, healthy relationship. So is that something that you'd be willing to work on with me? So when we're coming into any of these conversations, it's important to kind of have a little pre-check where we're making sure that we have a good intention for both ourselves and the other person. If we go into a conversation with the intention to prove someone else wrong, or to be right, or to retaliate in some way, guess what? It's not going to go well. So if we go in using like the nurse at work as an example, if we go in with the intention to have the best outcome for the patient and have a great working relationship with this nurse, that is going to come through in our communication. If we're coming into it just wanting to prove them wrong and saying, well, you clearly don't understand this condition. I have had so much more training than you, and this is my license, and I'm the one who's liable. the tone is just different, and it's not going to be received. It's going to be received with defensiveness, and the communication breaks down. So go in with a good intention for the whole situation, including the other person, including yourself, and make sure you feel connected to yourself in a kind way, that you're not just defending because you feel insecure somewhere. Make sure you feel solid in who you are and how you feel about yourself before trying to communicate with someone in this way. So here we're going to have a couple more examples.
So here's an example of maybe a doctor to patient. And for those of you that dispense pain medication, you may connect with this a little bit. So a violent or reactive response to asking about a pain medication to be prescribed would be, "You're just here for drugs again. I already told you I won't prescribe anything stronger." Okay, that might work. But something that might work a little better, that is more based in empathy and allows you to accept responsibility for where you're coming from, is, "When I hear that you're still in pain despite the current plan, I feel concerned because I want to make sure we're treating the root cause, not just masking symptoms. Would you be willing to talk about other options we can explore together?" Why does this work? Well, the second response expresses care and holds boundaries without shaming the patient or assuming intent. It takes practice, guys. I mean, this is not intuitive, especially if this is the 18th out of 20 patient for the day. This is going to take a lot of intentionality. So we're just offering up suggestions here, but know that this will take a lot of intentionality and practice.
Yeah. And the other piece is to let go of the outcome, because what you're in control of is how you show up. So you can know that you're not making that drug-seeking patient worse by being a jerk. When you frame your communication this way, they may not respond well. It doesn't matter. What matters is how we show up, and that we're showing up in a kind, clear way that holds our own boundaries without being rude and without communicating in a way that can make the situation worse, if that makes sense. So again, whether it works or not is more about how you feel about how you show up and how you feel about how you communicated. It's really not as much about how the other person receives it, although this will increase the likelihood they receive it well.
So here's another example, which for shift workers comes into play. Waiting on that doctor to come in for checkout who's late once again. So a violent way of communicating would be, well, first of all, I think also like subversively, I think I would just stew and say nothing, which also is not, that's violent against myself.
Yep.
So, but externally would be, "You're always late and clearly don't respect anyone else's time," or go say that sort of thing to all your other colleagues to get everybody riled up at that person. Nonviolent, which would be clear and connected, would be, "Hey, when you arrive after our agreed handoff time, I feel frustrated because I need reliability so I can get home on time too. Would you be open to talking about what might help stick to a better schedule? Or would you be open to texting me when you know you're going to be 5 minutes late so that I can make other arrangements," or something like that. When Laura and I used to work in a single coverage place, that's terrifying when your relief didn't show up. Like, is he in a car crash and you're going to be up for another 8 hours? Or like, there's all kinds of stuff with single coverage, things that start popping up when people are late. Even not single coverage, it's easy to catastrophize and be like, "Oh God."
Yeah, and it's amazing how quickly you go into fight or flight. As soon as like 1 minute past the time they're supposed to be there, you're like, "Oh crap."
Oh, 100%. I've been counting down the hours
I
to
know.
minute.
I know.
All of a sudden it's not up. Yeah.
No.
But you see how like non-accusatory, but you're also not being steamrolled. You are saying, "Hey, this matters to me because I've got kids I got to go pick up. I need to figure out another plan." Like the reason why I get so activated is because of really good reasons.
Right.
Plus my time matters too, So
yes.
I like that we're not just putting up with it, but we're also not violent.
Right.
So why this works, the second version shifts from accusation to collaboration, naming the need, which was reliability. It's a very common need. I think that's not unreasonable, and opening the door for a solution.
Yep. All right. Doctor to spouse after a long shift.
Dun,
Now,
dun.
Dun, dun, dun. Nobody listening to this would ever talk to their spouse like this, I'm sure. However, it has happened. So imagine this very self-important doctor coming home being sarcastic and dismissive. Wow, must be nice to sit at home all day while I've been running around saving lives. Ha ha ha.
Mm-hmm.
And then the nonviolent way, which would require vulnerability and clarity. I'm feeling exhausted and a little overwhelmed after today. I'd really appreciate some help unwinding tonight, or even just a few minutes to myself. Would that be okay? It's because I'm imagining in this scenario, spouse is coming home to a bunch of young children going crazy. The doctor is, and then the spouse is at home. We're just waiting for help to arrive also.
Please. Yes.
Please, please.
We've been on both
And
sides.
yes, absolutely. And so coming home from work, and if we're really truly feeling overwhelmed, just making that request. Hey, I'm just so overwhelmed. Can I just have a few minutes? And I promise I'll re-engage after I get myself a little more regulated. Why does this work? The second response invites support without resentment and without sarcasm. Like sarcasm works well in some scenarios, generally not at home with the people you love, unless you have special circumstances, which some of us do. Generally, in a situation like this, sarcasm is not going to land well. So this response invites support without resentment and honors both people's needs. I recognize that you have needs and I have needs, and let's try to get both sets of needs met.
Yeah, I think that's crucial to understand. Just even holding space or acknowledging that both of you have needs. I think, especially in a relationship like a marriage, and especially in a two physician household, you start to like say, well, my job is this, or I am crazy busy. Or, I mean, I know early on, once my husband and I became attendings, I felt myself getting resentful because he had the go to work the same time, come home at the same time. He would have long days, but in ER shift work, I was like, one day I had an 8 a.m. shift, and then I'm going in at 2, and then I'm getting home at 2 or 6 a.m. or something, all over the place. And so I think one of the things that in therapy that helped us was just, holding space to recognize that both have needs. We both have, stressful jobs that have different things, but just asking for what I needed, like, hey, I am going to get home at 2 a.m. tonight. Would you be available to take, the kid to school at 6:30 so I don't have to get up, or whatever the request is? It's just understanding that both jobs are demanding. And I think also just asking for what you need was a big thing that, I don't know, some point just clicked in my brain that like I have permission to ask for what I need to, and go about it that way, instead of like my job's crazy because I go to work, all the different times of the day. So I think that's a much better approach. So if you have littles or a child who you want to spend time with, but maybe you're trying to get some work done at home, and so you're working on the charting, and maybe a violent way that's controlling and frustrated comes through, is if you say, go away or don't bother me, can't you see I'm working? You're being really annoying right now, which is, yes, can definitely come through. The frustration is coming through that loud and clear. Maybe another way to address this, or a nonviolent way to address this, is, sweetie, I see you really want my attention, and I love that. Right now, I'm finishing some work and I need some time, or I need some quiet for about 10 more minutes. Why don't you set a timer, and then we'll play together when it goes off? And, this really validates your child's need for connection and need for attention, but it also honors your need to just wrap up whatever you're doing. And I will say that that is really validating for a child, but also it honors boundaries. And I think one of the things I heard recently, I follow this child psychologist. She's amazing, but she just said, kids do well with boundaries. And when you set a boundary and uphold it, you're in self-integrity, like you're holding yourself to the promise that you're finishing this work, but you're also recognizing that boundaries are good and kids do well when they're boundaried. So this is an example of both of those, and we'll go over a lot better than just you're annoying,
Yes.
go away.
Yeah. And you're showing that you're being reliable. And when it is important, I'm glad that you mentioned boundaries. It is important with kids to show them that we also have needs. And we don't want to raise little narcissists. That's important. Definitely we can be violent in terms of being mean or over controlling, but we can also damage them when we falsely empower them or don't hold boundaries or show them that it's okay to run all over the parent. That's no better for them than being overly controlling. So I'm glad you pointed that out. That's a great way to show respect for them and for us. And that's important for them to see that. Okay, so one more example. This has happened to me. Sadly, the pandemic made it so that a lot of our nurses retired or moved on to do other things. And so we often have inexperienced nurses who might not realize the urgency of particular medical situations. For instance, I have had patients come in like a low brewing anaphylaxis. Like you can tell it's about to get bad. And so I said, I need this patient to get epi right now. And I put the order in and it might not happen. I've learned I'm just going to follow that nurse around till the epi gets injected into my patient because sometimes it doesn't. But a violent way to communicate with a nurse that way would be like, how could you forget? How could you be like doing all this other stuff, starting 2 IVs before you give the epi? Why would you do that? Like you are putting this patient's life at risk. That's blaming them. And as leaders, which as physicians we are, it's best for us to take responsibility for the whole situation and also invite them to their own piece of accountability by being calm. And we can be corrective too. Hey, I was expecting the epi to go in first before anything else. I felt very stressed and worried for the patient when I saw that 15 minutes after I ordered it had not gone in. I'm just guessing you don't realize how critical the timing is for this, because if anaphylaxis gets away from us, it's very, very hard to treat. So can we walk through what happened so we can make sure that this goes more smoothly next time? And why this works? Number one, if I'm talking to them and saying, how could you forget this? I can feel shame. Like I can feel the shame that person is going to feel. And guess what? When people feel shame, they aren't thinking. They aren't in their thinking brain. They are very much in their limbic system, and it's very hard to learn. They are learning something. They learn that you're an enemy. They aren't learning the thing you're trying to teach them. So when we can stay anchored in the shared goal of patient safety and be respectful and still express the emotional impact that the situation had on us. In this case, we don't even have to express our own emotional impact. We can just say, hey, I don't know if you realize what the implications of delaying the epinephrine are. We're seeking improvement without shaming people. And that is just going to create a better working environment and better patient outcomes too. Because then she's not going to be, or he is not going to be afraid to ask me clarifying questions another time. If I have shamed that nurse, if I have been blaming of them, they are not going to want to approach me with questions. So I always want to make sure that they feel safe to come and talk to me.
I think another way to make it even less accusatory is like, hey, hopefully this has never happened to you, but I have had a patient before that didn't get the epinephrine in time. And it turned out that it was way worse than getting it early. Like just from experience, then it's like, oh yeah, I don't want that to happen.
Yeah. Yeah. That's a great way to phrase it.
So this is such an important topic, but just hoping that we have relayed in a way that's able to be received, that this can really change your relationships because it can strengthen all types of human connections. And doctors have very emotionally complex lives. So this can help all sorts of places. With staff, it can improve morale. It can foster respect and teamwork. With patients, you can build trust easier. It reduces conflicts and increases adherence to your recommendations. And with your colleagues, it encourages collaborative problem solving instead of silent resentment or brawls. Either way,
The throwdown's on.
I think usually we have silent resentment with each other, but occasionally you will meet a character that is not silent. This can help with that too. How it helps at home with your partners is to reduce reactive conversation and incessant shame cycles. That's just not that helpful for good relationships. And with your kids, it models emotional intelligence and invites openness. The thing that we say over and over is that you have to show people, not tell them. Unfortunately, with your kids, you might say, oh, you're so great and you should be so confident. But if you're not modeling that yourself, it's just a much more effective way with your kids to model this emotional intelligence. And so for you to be able to practice this and learn this for yourself, it is a gift for your children, not just immediately, but it'll show them how to be with their own families. A real life example would be like a team member says, this place is a mess, no one cares. And without nonviolent communication, you might say, what are you talking about? You're being so dramatic. It's not even true. With nonviolent communication, you could say, when I hear you say that, I feel concerned because I want everyone to feel valued here. Can you help me understand what's going on for you? That is coming from a place of curiosity rather than judgment. The big shift when you start using nonviolent communication is that it moves us from reacting to responding. It moves you from disconnection to mutual understanding. It moves you from defensiveness to curiosity. And so here's a quote that can help drive it home. Empathy is a respectful understanding of what others are experiencing. Instead of offering empathy, we often have a strong urge to give advice or reassurance. But empathy requires us to stay present. That's from Marshall Rosenberg.
So thank you for joining us. We hope that you were able to get some pearls from this. It might be a little touchy at first. I understand, it's going to trigger a few things, and that's okay. Just be aware of what it does trigger in the certain situations in the examples. Laura provided some great examples today. And just know that we are for you. We see you. We know that this is going to take intentionality and it'll take a little practice. So you might have to listen to this episode a few times. We invite you to. We invite you to just see and reflect on what your communication patterns are like. Even if you just notice them the next time you work and just see oh yeah, I might have been able to do that a little differently. Maybe just inviting you to try on one of the phrases that we used, one of the nonviolent communication examples, especially, maybe try it on in a not so emotionally charged space first. So you get a little practice, because then when it is stressful or very emotionally charged, you'll have that mental muscle to stay up front in your prefrontal cortex and make the decision to communicate nonviolently. There will be a little cheat sheet, a nonviolent communication cheat sheet in the show notes, and it'll be downloadable, as well as the links to the books that Laura mentioned today, the one about nonviolent communication, self-titled, and also Crucial Conversations.
Can I add something about Crucial Conversations? Just I recommended this to a client who had to talk to a staff member in his office, and he was also blown away by it. This is a life-changing book to help you with hard conversations. So if you're dreading some kind of conversation, check that book out. It is awesome.
Right. And we can always learn, right? This is not about winning or losing or failing what you've done in the past. It's just about being aware and learning, and just, starting small, even just noticing your own feelings and needs really can give you that personal or that internal validation and really empower you to move forward in adopting this nonviolent communication. Nonviolent communication isn't about being nice. It's about being real. It's about saying the truth in a way that invites others to meet you right where you're at. So we hope you have enjoyed this. Leave us a review, comment. Also, if you have any experience with this or further questions about this, or want to schedule a session and practice, click the link in the show notes or send us an email at podcast@thewholephysician.com. We also want you to check out our new free video, How to Crush Physician Burnout for Good Without Cutting Back Hours, Quitting Medicine, or Sucking It Up in Silence. All of these links are in the show notes. Scroll down and check it out today. Until next time, you are whole. You are a gift to medicine, and the work you do matters.